Here's another story we've been bringing you this morning. The World Health Organization's Director General, Dr Tedros Ghebreyesus, is today visiting South Africa's vaccine sites. He will visit facilities including Afrigen Biologics and Vaccines at the Biomedical Research Institute based at Stellenbosch University's Tygerburg campus and Biovac. We earlier crossed to SABC News reporter Bulelani Phillip.
They've made it clear that they want this facility to be here in South Africa because, more importantly, we're a middle-income country. We have the institutional capacity, not only in terms of health, but also in terms of research, knowledge production and education. But I think also that it's centrally based in order for us to make an intervention in the continent. I mean, remember, Afrigen, would hopefully by the end of the year be starting with clinical trials, which means that Biovac, which is our national, vaccination producing company, would then be ready to start with vaccine, production for the rest of the continent. And this is why the Director General and the people who are accompanying him are so excited about the progress that we've made here in such a short space of time. A lot of people are quite doubtful whether we'll be able to come even up to this level. We've also listened to some of the concerns that have been raised, and the Director General indicated that they are willing to come and intervene. And as the South African government, we also remain committed to make sure that this is a success. And remember, it's not only for COVID-19. We also have the potential now to produce vaccine for malaria, for tuberculosis, and even for HIV/AIDS, which means that dependence from importing, this kind of vaccine from all over the world will now stop, and that we will become the hub for the rest of the continent. So that's why this is so exciting a visit by the Director General.
Talking about the concerns that we've heard, there's also been some quarters of society where there is a hesitancy in terms of vaccination take-up. Do you think there is enough confidence in the South African research capacity to produce a vaccine that will be credible?
Well, most definitely. We not only have relied on existing knowledge that have been used all over the world and research, but we've also complemented it with our own, internal capacity. And remember that we top in the world in terms of studying the mutation of COVID-19 over the years. We've now, recently become at the center stage of announcing, Omicron. What we are aware of is the fact that there still remains, not only in South Africa but even in the continent, that hesitation, and more so that it is a vaccination that is being produced in our continent. We are excited about the quality of the work that is coming out of here. So there's no doubt that the vaccines that will be coming out here will be any different from any vaccines that comes anywhere in the world. We have to work on the mental preparedness of South Africans and of people all over the world. Vaccination saves lives, and that it is only through, as the President said yesterday, that we can have massification of vaccination, that we can be able to now start relaxing some of the regulations, but also that we can start seeing, more and more people recovering from COVID-19 and relieving pressure in our health facilities. So I also want to take this opportunity to call on all South Africans, particularly young people, where we've found a bit of resistance and hesitation, that let us go out there and vaccinate. It is the only way in which we can protect ourselves against COVID-19.